Today I will be speaking to you about a new COVID-19 virus variant that we have been hearing about. Now this virus is called as COVID-19 Omicron subvariant XBB 1.5. For the sake of simplicity, let's call it as XBB 1.5. Now this is just a subvariant or a different sort of subgroup of COVID-19 virus which we all know about. We also know about the Omicron variant since the last 1.5 to 2 years. Now this is again a subvariant of the Omicron group and it's known as XBB 1.5. As you might have already heard in the news or read in the newspapers, this virus is creating some news across the world and even here in India. The reason being that the scientists have identified that this particular virus is a bit different from the previous versions in that this virus escapes the protection that is offered to us by our immune system, which means this virus very tactfully and intelligently escapes the antibody protection that our body provides us, which means to say this virus can be a bit of problem and will need treatment if the person infected by this virus is symptomatic. This would also mean that whatever protection our body could have offered us is no longer able to do so because this evades the immunity of the body. So that is where the real problem is. So this XBB 1.5 was initially detected in the Western world, and between October 2022 to January 2023, about 5,300 cases were detected in the world, and vast majority of these cases came from United States of America, United Kingdom and Denmark. But now the cases are now being reported all over the world and here in India as well. In fact, you might have recently seen the news from the Department of Health saying that there has been some concern about the rising cases of COVID-19 in India, and it is possible that these cases might be due to the new variant, that's XBB 1.5. So as of now, because the cases are just minimally higher in numbers, we are doing the usual test for COVID-19, that's the RT-PCR test. But to confirm whether the infection is due to XBB 1.5, we need to do a further test called genomic sequencing. That is not being done routinely at the moment because the caseload is not very high. Although the World Health Organization has advised that genomic sequencing should be done if the cases are rising to identify the subvariant of COVID-19. It is possible that we may have to do it in the near future should the COVID cases continue to rise. Now the next question is what to do if someone is diagnosed with COVID-19 infection today. Well, the guidelines have changed slightly. If a patient is detected or diagnosed to have COVID-19 infection and if the patient is symptomatic, that's the patient is having symptoms like fever, cough, cold, generalized weakness and various other manifestations of COVID-19 infection, then the WHO recommendations as of now is 10 days of isolation from the day of start of the symptoms. Please remember, it's from the day of the start of symptoms, not from the day of diagnosis. So how about those sort of individuals who are COVID-19 positive on the test, RT-PCR, but do not have any symptoms? If that's the case, the WHO recommendations is that they should isolate themselves for just 5 days. And during this isolation, if they turn negative for COVID infection by retesting, then they can come out of isolation. Now, this is a new subvariant virus. We do not know much about the nature of this particular virus and the severity of the illness that this virus could cause. And I would say the same old adage, prevention is better than cure. Mask up, wear your mask, keep yourself safe. And should you have any symptoms suspicious of COVID-19, please see your doctor and ask for COVID-19 testing, particularly elderly individuals, pregnant ladies, kids, diabetic patient, heart failure and kidney patients. Thank you very much for listening.